And welcome back. Incontinence is a big problem for many women, and some feel embarrassed and may not even know that there are treatment options available. So joining us now is Dr. Sumana Koduri and Registered Nurse Rachel Borchard. They are from the Women's Center for Incontinence and Pelvic Health at SAAK Health. We're going to chat about their team approach to evaluation, treatment, and care. It's great to see you again, doctor, and good morning to you too, Rachel. Last time we talked quite a bit about incontinence, and I love that you shared some things that I'd never learned before, that there are different types that affect women. I remember we talked about sort of the standard stress incontinence that a lot of people are familiar with, but then something like urgency incontinence. So there are different types. As you evaluate a patient, that's what you're looking at, right?
That's in the initial consultation that I'm doing with the patient. I'm really getting kind of honing down on their symptoms and trying to see what type of incontinence they have. And sometimes we have to do tests to kind of evaluate further to discern all of these things. Sometimes it's really hard to tell the difference. So we do tests, specifically a test called urodynamics, where we're checking out the functioning of the bladder. And then once we've kind of established kind of where we're going, we will discuss the different types of treatments. Sometimes people have both types of incontinence and they need treatments for both types of incontinence. So we kind of have to lay out that plan for them.
You know, we've talked before about hearing problems, that many people who need hearing aids or have hearing issues wait a really long time before they see a doctor. I bet you see the same thing.
Because it's a little bit of an embarrassing thing to talk about, you know, it takes time for people to bring it up. It takes time for, sometimes it's not bothering me all that much, so then they wait, or sometimes it is a matter of just embarrassed to talk about it.
Well, yeah, and sometimes you think, well, I'm managing it okay, or you hear that it's a normal part of either aging or having kids or menopause, and so you sort of normalize it and don't think you deserve the care that you need.
Right.
Rachel, let's talk about what you do as part of this team approach.
Yeah, so I help with the bladder testing that we were talking about, kind of help to differentiate the different types of incontinence that a woman might have. We do that bladder testing, and then I do any of the patient education, the follow-up, just make sure that they get any of the follow-up appointments that they need, all their answers or questions answered. When they call the clinic, they can typically get a hold of me directly very easily.
I bet the education part of it's really important, right? Because it's just sort of understanding what your issue is and how the treatment option that the doctor recommends, how that's going to benefit you.
Yeah, so just doing a lot of that education is a big part of our teamwork too, kind of following up with the patients and all of that.
Yeah, I visited SAAK Health, and I love that you have this specialty available at your new facility, which is beautiful. It's easy access. We're looking at video right now. It's so easy to park there. It's easy to make an appointment. It's easy to have an evaluation. Your rooms are clean and beautiful, and you know, cutting edge technology. Even the chair where you examine people, I was so impressed with. It's not your typical OBGYN with the metal stirrups, and I'm just so impressed at the way that you are approaching some of these specialties. And I think yours, along with the other doctors there, is so critically important for people's, not just their health, but their well-being and their happiness in life.
Thank you. I mean, our focus is trying to improve the quality of a person's life, you know.
Yeah.
And Rachel and I have worked together for some time. Patients are seeing us, and then we're able to follow through and give them a consistency, I think, that makes them comfortable.
Do you have to be referred from your regular physician or another doctor in order to be seen by a specialist like you?
For some insurances, a lot of it is insurance-based. So some insurances do ask a referral to be placed. Other ones can just come to us directly.
In terms of your team approach, how do you evaluate people and then work toward a treatment plan and managing in that?
Yeah, so again, the initial consultation I am doing with the patient. And once we've kind of determined what route they're wanting to go, it could be maybe pursuing some non-invasive type of things initially before you go for things like a surgery, right? And if there's any non-invasive things that we can do in the office, we're going to help them with that. Some of the treatments, they'll see my nurse. Some of the treatments, they'll go to a therapist, and then they'll come back to me. We'll touch base again and then go forward from there. If they need any further evaluation or treatments, then we can kind of move forward from there. So we just go by a step-by-step approach and work together on that.
And I love that all of those things can happen at your office, which again and is so beautiful and easy to get to and find and make an appointment. Lovely to have you guys here. Thank you so much for your time.
Molly.
And I want to make sure that everybody knows that the SAAK Health Women's Center for Incontinence and Pelvic Health, they are a team of women taking care of women. Their beautiful new campus is located on West Capitol Drive in Brookfield. For more information, you can call this number to make an appointment. It's 262-444-5148 or visit SAAKhealth.com.